It's 4:30 p.m. here in Seoul. I'm Devin Whiting at the Arirang News Center, and it's time for today's briefing from the South Korean health authorities. We should be getting updates on case numbers and trends, as well as progress in the vaccine campaign. Let's go and see. It looks like they're about to start. Officials coming up to the podium there now. Let's listen in.
Today's briefing will be provided by Mr. Son Young-rae of Central Disaster Management Headquarters, and we will also have Mr. Kang Sung-tae present from the Ministry of Culture and Sports, and we will be providing sign language translation. First, we will hear from Mr. Son Young-rae about the countermeasures against COVID-19. I will start the regular briefing for May 9, Sunday. Over the past week, there were some developments, and I'll update you on those. Over the past week, there were 565 newly confirmed cases on a daily average, and compared to 597 from the previous week, there was a 5.4% decrease. And the reproduction rate across the country is 0.94, which is a slight decrease from the previous week as well. Starting from end of April to until last week, we have seen a decrease in the number of patients. However, considering that there is a holiday and that this decrease is very small, we are not for sure saying that this is a decrease. However, we are seeing the decrease in the worldwide trend, and we are seeing a decrease especially in Asian countries. Therefore, we believe that it is a fortunate thing. We think it is thanks to the efforts of our citizens who adhere to the countermeasures. So we want to thank everyone. The medical system for patients has no problem. For the critically, we have secured 72%, and we still have 566 hospital beds available, and no one is waiting to be hospitalized. And for those with minor illnesses, we still have 9,000 hospital beds available, which is around 58%. And with the seasonality, there is an increase in the outdoor activities, and we believe that this is contributing to the decrease in the newly confirmed cases. However, there are still risks such as increase in activities and also the variant form of the virus. Therefore, we want to ask our citizens to avoid events that are happening indoors in confined spaces with a lot of people. And if it is unnecessary, we ask you to go outdoors instead of staying indoors. And when you're staying indoors, please make sure to open your windows at all times and ventilate often. Next month, at the end of next month, we will see the completion of the vaccination for the elderly, and it is especially important for us to decrease the number of newly confirmed cases until then, and we believe that we will have more room starting in July. Now I'll update you on the monitoring that we have done. Starting on April 15th, 24 local governments has gone through monitoring for the relevant facilities. And there were 463 cases where the minister and vice ministers themselves actually went to do the monitoring themselves. And for those that were violated, then we have asked for corrective actions immediately. And if necessary, we will be penalizing. And in addition to it, we have also come up with a separate task force team. The central government and 200 local government officials are in this task force, and we have done the monitoring for more than 11,000 places, and we have seen 4,900 cases of violation. And we have actually provided the necessary measures as given. Over the 2 weeks, we have done special monitoring, and we have decided to dismiss it. However, the government will make sure to have the local governments monitor as necessary, even if it's not within the special period. Today, we had a meeting with the CDC, and we talked about the disease control measures for religious facilities. over the past months, we have seen a slight increase in the number of confirmed cases in churches, which happened to be 39 cases. We didn't have massive outbreak, however, we had small cluster outbreaks that are repetitively happening. Ministry of Culture and Sports will make sure to have leaders monitor the sites themselves, and we are also asking for cooperation from the leaders of the religious facilities. And we are also going to provide data, and we are linking call centers so that we can provide more efforts for the relevant personnel. And we have the Buddha's Day coming up and other holidays coming up, so therefore we want to ask the leaders of the religious facilities to especially take initiatives. Starting tomorrow, we will start reservation for vaccination for those who are more than 65 years old. And starting later on, we are going to start vaccinations for those that are more than 60 years old. We are already getting reservations for those that are more than 70 years old, and we are seeing that the reservation rate is about a quarter. For the elderly, it is the most effective way to be safe, and this is vaccination. And experts from both home and abroad are explaining that the benefit of vaccination is higher than the risk, and this is especially high for those that are elderly. COVID-19 is especially fatal for those that are older. When patients are more than 60 years old, the risk increases to 5.5%, which is actually around 5 cases of deaths out of 800 people. And of the 1,800 cases of deaths that we faced until now, more than 95% came from those that were 60 or older. And by only the first dose of vaccination, we can actually prevent COVID-19 by 80%. By vaccinating ourselves, we will be able to prevent ourselves getting COVID-19. And even if we do get infected with COVID-19, we will not be critically ill. And for the blood clots, it only happens for 0.001 people out of 800. Compared to the fatality rate, this is incomparable. This is a very small number, and we haven't seen a direct case in Korea yet. And when we can actually find it at an early stage, we will be able to treat it. Therefore, you don't have to worry about the rumors that come up without scientific grounds. And we also have experts that are verifying the contents. And based on the results, until the end of April, there were 67 cases of death, and 65 cases were unrelated to vaccinations. And for the remaining 2 cases, we are asking for results of autopsy. So we have seen small symptoms that come up after vaccination. However, we have seen that most are false. And across the world, there are other scientific verifications being carried out, and the results were same there as well. For AstraZeneca, there are developed nations that are not taking it, and there were some rumors about this. However, for AstraZeneca, there are some countries across the world that are actually using it, such as England and some countries in Europe. And for vaccination, actually 2/3 of those that were vaccinated across the world were vaccinated with AstraZeneca. We have actually gone through with it because we found that there were no issues with it. The Prime Minister, the President, and some ministers also were vaccinated with AstraZeneca. And in the world, there were nations such as the UK and Germany where they have prime ministers be vaccinated with AstraZeneca. Dear citizens, and especially to our elderly citizens, we want to plead to you. We want to ask you to be vaccinated for sure. This is not for us to actually achieve the target and to achieve the mass immunization, but this is to actually to keep you safe. So for vaccination, it should not be 70% or 80% of the population getting it done, but we should actually have 100% of all our elderly population get vaccinated. And this is the objective decision that came up from the scientific results. And this is actually what we believe in by our CDC. Therefore, that is why we are starting with our elderly citizens in terms of vaccination. So we want to ask you to not believe in rumors and not be worried too much. And we will also want to ask those around the elderly citizens. We want to ask you to explain to them why vaccination is necessary and to help them with reservation. Online, you can actually make the reservation through smartphones, and family members can actually delegate the reservation as well. And we believe that it is absolutely necessary for our elderly citizens to be vaccinated. Through vaccinations, we hope that our citizens will be able to resume their daily lives as soon as possible. Thank you.
네, 지금부터 질의응답 시간을 가지겠습니다. 배석자분께서는 단상 위로
And that'll conclude our coverage of this briefing. Thank you for watching. Arirang News will be back at 6 p.m. Korea time.